Right, let's get started. My name is Deborah Ruzick. I'm a agent of independent broker. The company I work out of is my brother's. It's MR Insurance Partners Agency. We are close to downtown Cleveland on the east side. And I've been doing this for 12 years and I really enjoy it. So we're just going to go over today what you can do during annual enrollment period to possibly save yourself some money and add additional benefits to your plans. Oh, there we go. So these are steps we can take in the coming year for 2022. And the first thing is the annual notice of change that you'll receive every year, late September, which gives you a side-to-side expansion or a comparison of your 2021 plan that you currently have and your 2022 plan. It's going to list all the changes you may have, changes in copays, changes in premiums, changes in drug coverage, everything that you need to know. So it's really very important to really kind of look at that side to side so you don't have any surprises in 2022. On January 1st comes along and you go, oh, my doctor's no longer a network or they're not covering my drug. So it's really good to really go over this every year. And I can help you with that as well. And we have a hot tip. So it's every year look up and calculate your potential prescription costs under the new formulary because those change every year. The formularies are different from plan to plan as well.
And I hear that for a lot of seniors, that is their biggest expense for sure.
Right, especially with the diabetic clients. They're so expensive with insulin and the pens, but there's a lot of different programs now that they are offering to help people afford their insulin and their pens and what they need for their diabetic issues. So with the plan networks, this is important to make sure your docs are a network. If you have an HMO or a health maintenance plan, you have to stay in the network. If you don't stay in the network of the HMO, you will not be covered. You will be fully responsible for your bills. On the other side, if you have a preferred provider plan or a PPO, you can go out of network, but you are going to pay more for services. And all the time, anywhere you are, you're always covered with emergencies. So if you're out, if you're out of the state, you're always covered for an emergency. So just say, again, pay close attention to your ANOC for your doctors and facilities for the coming year. I believe we have a tip. Yes, we do. I'm kind of covering that up. But there may be changes, and there may be a change in your what's going to happen with you next year as far as your health. I mean, maybe you're going to be having a hip replacement or a knee replacement, or which I just went through. And you just want to be prepared for that because you're going to have a lot of rehab to go through. And you kind of want to watch what your rehab costs are going to be, et cetera.
On the emergency care, do you know of different carriers being fussier than others on what they count as an emergency?
Anything that you feel is life-threatening or anything you feel is urgent, urgent in your mind. I mean, obviously, if you have a sore throat or, something like that, it's really not urgent, but people still use the emergency room for situations like that. But, the past year now, if you have a sore throat, you may have a big problem. So, but the other thing is, but that's mostly it. But it has to be life-threatening in your mind, and they'll cover it. So these are just the enrollment periods, which we are in now. We're in the annual enrollment period, which began October 15th through September 7th. And that's the same for everyone every year. And you can change your Medicare Advantage plan. You can change your prescription drug plan. And once again, that's what you want to go over to see what's going to pull up for you. That's going to be maybe a little improvement from what you had this year. And then January 1st to March 31st is what they call the open enrollment period. And this just began 2 years ago. With this, you can change from one Medicare Advantage plan to another Advantage plan, or drop an Advantage plan to original Medicare and a separate drug plan. Now, year round, if you're on a supplement, you can go in and out of a supplement. as you desire, but it will not be a guaranteed issue, which means they're going to underwrite you. So they're going to underwrite your health and your age, and however they do the underwriting. So they have, to get enrolled in that plan, they have to accept you. Oops. Here's a hot tip. So missing your opportunity could lock you into a plan that costs you more than others for a whole year. You don't want that surprise in 2022. But choosing a Medicare plan is not something that one size fits all. For instance, your Aunt Betty says to you, oh, I have Anthem, the premier HMO, and that's like the best plan on the planet, and I love it and it works for me. Well, that's not necessarily your best plan, because you have to look at all different factors. If your doctors are in network, your prescription are at the lowest levels possible, and your expected needs for specialists, therapists, et cetera, add up to the lowest possible costs out of pocket. Like I said, if you expect to have a lot of rehab in the following year, it's better to find a plan with less rehab cost if you can. And there are some out there, they vary from plan to plan. Now, additional benefits, more plans are adding non-traditional benefits, like comprehensive dental, eyewear unrelated to surgery, over-the-counter medications, which they give you a catalog, and you can order over-the-counter like aspirins and safety equipment for your bathroom, anything like that that's over-the-counter, which is a great benefit. And they're doing about $80 a quarter on the average per plan. Healthy meal deliveries they're doing now for if you're in the hospital. They give you like 14 meals delivered to your home. And transportation to appointments, this is relatively new. And they're including acupuncture, which was unheard of, and telehealth and chiropractors. And the good thing about this, 12 years ago, when I started working with Medicare people, they didn't have any dental or any of this really built into the plans. And it was kind of always a pet peeve for me, because if you don't have healthy dental, if you don't have a healthy dental or preventative or whatever, it could really affect your health in a very severe way. So they did listen, and they finally started including the dental. I believe we have a hot tip. Yes, we do. Yeah, so this is, once again, think about services that you're going to need and what it might cost you out of pocket if you don't have them embedded in your plan overall. Now, this is a new Part B give back. This is new for this year. It started in 2021 with a couple of plans and a couple of the carriers. And what they're doing is they're giving back part of your Part B premium. So that's your $148.50 that comes out of your Social Security if you're collecting Social Security. And they put that back into your Social Security account. And the Part B give backs have been up to $99 a month. So that goes back into your Social Security check. On the other hand, though, they might not be as rich. They might have a 20% copay for PCP or primary care, and a 20% for specialists. You'll have a little more out of pocket, but it's a really good idea if you're very, very healthy. That Part B give back would be worth looking into. It's a hot tip. So you compare your plan's premium cost by considering the plan premium plus your Part B premium and plus the plan's give back, and then you'll see what your premium is going to be for the month. And these are pitfalls if you don't sign up for Part B when you are eligible. So your Part A is your inpatient hospital, skilled nursing, and hospice. And Part B is your outpatient hospital, anything else that Part A doesn't cover. Medical services, x-rays, MRIs. Premium for most people, as I said before, is the $148.50. Higher incomes will pay more, and penalties can incur for late enrollment. So, if you're working for an employer and you have credible coverage through your employer, you can choose between the company health coverage or Part B without any penalty. But once you don't have credible coverage anymore, then you kind of fall into that penalty phase. And it can be very, very high. It can be 10% a month, but you don't have coverage on Part B when you finally apply for it or enroll in it. So prescription drug coverage, that's another thing you can get penalties on if you let a period of 63 or more days pass in a row. You don't have credible prescription coverage. They will assess you a 1% average national average of a drug plan per month. And these penalties, just like the Part B penalties, those stay with you for life. They never go away. So it really is important that. Be saying something?
We got a question on the Part B premium, and I wanted to touch on it before you got too far off subject.
Okay,
they're asking what for most people it is for 2022.
I had a little drink of water. It's $148.50. It doesn't seem to be good. It's not going up this year or 2022. It should stay the same at $148.50 unless you're in the higher income, then there's a bracket that you have to go look at. But
and touch on again, because I heard something about premium give back, but can you elaborate on who qualifies and what kinds of you
don't have to qualify for it. It's just it's a Medicare Advantage plan. So I mean, Medicare Advantage plans are guaranteed issue. There's no medical questions on those. So there's no qualifying with that. It's just if you want that plan, you can sign up for it. Any other questions?
This would be a great time. Type them or unmute yourself since I have her derailed.
Do you think?
My job.
You derailed me. That's okay. We want people to ask questions.
We do. There was can you touch on what qualifies as higher income?
I don't have the IRMA in front of me, but you're looking at, probably for a spouse and a spouse, it's going to be over $200,000 somewhere in there. And you're going to get hit with a higher premium. Anybody, anything else?
Not related to premium, but potentially related to penalties. There's been a question about the Christian health cost sharing ministry that's like not traditional insurance, but it's a way of covering each other's costs. I don't know how much research you've done on them, how much you want to talk about, like still enroll in Medicare because you don't want penalties, or if that's, I don't know how much you've researched it, so I don't want to put you on the spot too much, but that was a question that came up.
That's the first time I've had that question, and it's interesting. Now that's something I have to go back and research, but I'm not quite sure if that would be considered credible coverage or not. I'm not sure. That's something I would have to look into, and I can get an answer back for you.
Thank you.
That's a great question. Great question.
Just Anybody so you know from the chat, you're probably getting an appointment set up tomorrow.
Okay. Okay, great. Thank you. Anybody, anything else for anybody? Any questions or comments? A joke, anything?
What is the mandatory enrollment period? I mean, is it, I know that you're supposed to enroll before you're 65, and I'm 64, so I don't know what I'm supposed to do. Do you get something in the mail or something?
You'll get bombarded with mail. But with the rule of thumb is 3 months before you turn 65, the month you turn 65, and 3 months after you turn 65 is your enrollment time. So you have 7 months to decide what you're going to do. Now, if you're working and you have credible coverage with your employer, if you want to stay with your employer, it would behoove you to see what your cost is going to be with your employee plan compared to your Medicare if you decide to do the Medicare. Because I know some people are paying quite a bit of premium just for, for their credible coverage with the company. So, that's another option. And if there's 20 or more employees in the company, they have to offer you employer coverage. A company with 20 people and under, they do not have to. So that would automatically bump you into, having to enroll in Part A or Part B. You're automatically enrolled in Part A. The Part B, if you're working and you're not collecting Social Security, you have to enroll. If you are collecting Social Security, they will automatically enroll you. And it will go into effect the first day of the month of your birthday, as long as you get it done before the first 3 months. Does that help? But like I said, you're going to get so much mail. And unfortunately, some of the mailings are just very, very threatening. And I don't understand why the Center for Medicare and Medicaid is letting these go out. But, they send stuff out to people like, do something now or you could lose your benefits, and people panic and they go, oh my God, what do I do? So, so that's kind of a poor way to do it. But things like that go out and you'll see them. Because you will get plenty of mail that reminds you probably 6 or 7 months before you're ready to turn 65. Anything else? Anyone?
Not yet. You have to go ahead and then we'll think of some more and interrupt
we
you
did the
later.
drug coverage. Yeah, so this is if you have a Medicare Advantage plan, our hot tip, it probably includes credible coverage with your drugs. If not, if you have a supplement, you likely need a standalone Part D. There are some Medicare Advantage plans that don't include prescription drugs, and those plans are really kind of geared towards our veterans, because many of the veterans use the VA for their prescriptions. So they're the only people that can be doubly insured, because they can have their VA benefits and they can also get into a Medicare plan if they would like to, as a backup plan. And this is a really important spot a scammer. Like I said, never give people your Social Security number over the phone. Bank accounts, Medicare ID numbers. Social Security only corresponds with you by mail, or if you have an account on the Social Security website, they will, let you know in your email that they have a message for you. There's been sadly a lot of people lost a lot of money with scammers, and it happened to my mother. Lived in Chesterland, and there was two grandparent families, two sets of grandparents that got hit for $10,000 each. They called it the grandparent scam, and they would call the grandparent up and say, oh, your son or your grandson or your granddaughter's in jail, and they were in a car accident and they're hurt, but they're okay. And we need $10,000, for before they go in front of the judge. And, they're grandparents and they panicked and they went and got the money and sent it to them. And this happened to my mother with my son, and they wanted $3,000. And thank God it was a blizzard. So my mother couldn't get to the bank before she talked to me. And finally she says, well, she was going to give him a credit card, but they don't take credit cards because there's a trace on those. They won't take credit cards. They take, money orders or wire the money to them. So just so you know, just be careful. There's a lot of very, very smart people that get scammed. It's just they're really, really, really good at it. Does anybody have any other questions about this? Okay.
I'll reiterate that
yes.
wiring money is the least traceable. The bank accounts and credit cards are more traceable, and
Right.
they typically don't want those as much. That's a clue. Your bank account's a little risky because they might be able to get into it and drain it. So
Right.
that can be both a scam and a credible. But just when in doubt, you almost always can buy yourself time.
Right.
You can always call back to your utility company or your insurance provider based on a number you look up to see if your billing's up to date and all of that stuff. You almost never need to do it in the call where they call you. You can almost always hang up and research it a little bit and get your bearings.
What I have found, most people, that I know, or I do the same thing. If I don't know who it is, if it's an unknown caller, I let it go to voicemail, and then I address it that way. So That's
A
always
lot
supposed
of
to
our
be my-
members do that to me. They don't recognize the
You?
531-1900 and I go to voicemail, and because I'm legit, I leave a message.
Right, exactly. If somebody wants to get a hold of me, they're going to leave me a message and a phone number and tell me why. So, any more questions about this? I'm also available by appointment at the AMLA office, and we can coordinate that with Christy, and her and I coordinate.